Hi, I'm Emily Jones, an Associate Professor at the Blavatnik School of Government, and we're hosting a series of reflections on the COVID-19 pandemic and public policy responses across the world. And today I'm really delighted to be joined by Jo Wolff, my colleague at the Blavatnik School, who's the Alfred Landecker Professor of Values and Public Policy. Jo, thanks for joining us. It's great to have you with us.
Absolutely my pleasure. Thank you for inviting me on.
So you've been reflecting on the ethical dilemmas that this pandemic is posing, and you've called COVID-19 a moral crisis for policymakers, for healthcare professionals, and for private citizens. Can you talk us through that a little bit more and the various moral dilemmas that this pandemic is raising?
Yes, of course. So early on in the pandemic, we were given a number of models about the health effects of different policies, who would live, who would die, if we lock down now, if we lock down later. Soon after that, we got economic models saying, what will happen to the economy if we do one thing or another. And these were discussed. But underlying all of it was really a type of moral discourse. What's important? What should we be caring about? So it's obvious we care about people, we care about their lives, we care about their health, we care about their prosperity. So this gives policymakers really a series of questions that are not just technical. They're not just about health and the economy. They're about what do we care about, what do we do about those values, how do we interact with the people. And so I would say, first off, for the government, there are questions about the public interest. What is the public interest? How do we act in the public interest? Part of that is acting for the people. So how is it that the government will act for the people? And the obvious things that will go through their minds, first of all, we've got to minimize deaths. We've got to keep people well, and we've got to keep them safe, and we've got to try to minimize economic harm. But at the same time, they'll want to know, are there groups that will need special treatment? Are there groups that are going to be specially affected? So it's not just that everyone's in the same boat. Different people will be affected in different ways. And so the government has to do all of those things and think, well, what is the best course of action for us? But at the same time, it has to act not just for the people, but with the people as well. So this means maintaining trust, respecting citizens, being transparent, understanding what to release and when. And everything has a complicated relationship. Because if we think the government has earned our trust, we'll be more likely to do what it says, and that will have health effects, and that will have economic effects. And economic policy has health effects, it has effects on trust, it has effects on how we regard the government. So just to use an example I've used in other cases, two values that the government has. One is reducing risk to people. Another is minimizing or managing their fear correctly. And it's well known in policing circles that one way to minimize risk is to increase fear. If you make people afraid of crime, they stay indoors. They don't go out at night. So you can reduce risk by increasing fear. Now, is that what you do in a pandemic? Do you exaggerate how bad it's going to be to get people to stay home? Or do you say, well, actually, fear is such a bad thing, we should minimize fear, even if that increases the risk a little bit? So even in a question about communication, you've got this very delicate balance between the harm of exposing people to risk and the harm of making people over fearful. And of course, the way you manage that will have reputational effects and so on. So everything is interrelated.
Great, that's a really good illustration there of the sort of big meta questions, I guess, policymakers are facing. And one of the things that we've heard in the headlines is perhaps below that meta level is of health professionals and actually making some really pretty tough ethical decisions on the front line about access to scarce medical resources. How on earth do they confront those kind of dilemmas? What should they be considering?
Well, for someone who's worked in bioethics and then human right to health, this is an incredibly concentrated case study of everything we learned and everything we thought. I mean, it really is amazing. And one of the debates that has been going on 20 years or more concerns allocation of scarce health resources. And so outside the particular pandemic, cases, for example, about organ transplant, who should get the organ? There's always going to be a limited number of organs, more people want them, who should get them? In this case, initially at least, the discussion was about who has access to intensive care unit beds. So you can have people in a similar condition, who gets the bed? Now, the doctor's dilemma, as it was called by George Bernard Shaw more than 100 years ago, who gets access to these scarce resources? And initially, Italy was the first country, I think, to have this problem. And we were getting reports that they were making the decision purely on an age basis. So older people shouldn't have access. And even at one point, there were stories saying that in some regions, people over 60 would be denied access. It's quite a low cut-off, particularly for someone who's just turned 60. This is a scary,
brings it home,
scary thing to hear. And there was a lot of criticism of that. Now, why should you make a pure age-based decision? But in fact, some health economists have argued this. So they've called it the fair innings argument, and that older people have had a fair crack at life, younger people haven't, so priority should go to younger people. And there's something to that. I mean, it's not everything, but there's something to that argument. I think most older people would perhaps be prepared to step aside for much younger people, maybe not just a little younger, but much younger. I think what is happening is that there are two things that are happening. One is this question, who gets the scarce resources? But the other thing is, well, how can we get more resources quickly? So we try to make the dilemma go away. And that's really, making the dilemma go away is really the type of human rights approach. If we don't have the resources, get them from somewhere. And every government is doing that or trying to do that, or at least in wealthy countries. We can talk about some developing countries later. So everyone is trying to increase the resources, but even so, even if you do that, there will always be a time lag. So there'll be hard decisions to be made.
At a global level, then you've got countries competing, and then there's a question of whether might is right and whether the wealthier countries are going to deprive others of those scarce resources. On the health kind of question and access to precious health resources at this time, are there other moral dilemmas that you've been thinking about that governments and policymakers are having to grapple with? What are the other moral choices that are being brought to the fore?
Well, in this particular resource allocation, there was a lot of opposition to pure age-based. And so most people have moved to a different view, which says it's all about chances of recovery. So this is traditional triage medicine, really battlefield medicine. It was quite interesting when I was first approached about what principles already exist for scarce allocation of resources in scarce circumstances. The first thing that came to mind to me was battlefield medicine, where you have a lot of victims, and who does a doctor go to first? And it's the person who will make best use of those resources in a way of being most likely to recover.
So Joe, on the battlefield, that's fascinating, because that's a very different way of making judgments than the economist sort of age-based argument, because presumably there are sort of some older people that are able to make a good recovery and contribution, and some younger people that are less able to do so. So how does one adjudicate between these different ways of making decisions?
Well, exactly. And even in what you said there was a really interesting contrast of two different concepts. One was recovery, the other was contribution. And do we want to say, well, the people who will make the biggest contribution to society should get the resources? Or do we want to say the person who has the best chance of recovery and good health should get the resources, which are quite different things? And there's a type of utilitarian argument that says, well, whoever can make the best contribution, whatever it is, should get the resources. But there's a more sort of Kantian argument that says people should be treated equally. It's not a matter of what you can contribute to society. That maybe you're a talented musician, you can contribute a lot. Why should that make a difference? Why should the fact you're talented give you greater right to life than anything else? I think what we need to think about here also is the strain on the doctors making the decisions. So do we really want someone at the bedside saying, well, what's your job? What do you do? How much do you earn? Who do you... What in their competence is the quality of people's health and the quality of them surviving in good condition. And there are very good reasons for thinking that those are the only things that should really matter at the bedside, aside from what people want. So people may have signed an advance directive saying, don't do anything heroic, treat me in a more simple way, and if I die, I die. Other people might want every intervention. So we need to respect people's wishes, but at the same time, beyond that, the people who can survive for longest in the best condition have a type of obvious priority.
So just coming back to that question of then the national decision making. So I guess hopefully from a human rights based approach, we can increase resources. You don't face these real dilemmas because everybody can get access to these scarce medical resources. But I guess in many countries that's not going to be the case. Think about vaccine deployment later. When we do have a vaccine, there's going to be sort of competition for who gets vaccinated and when. And again, there's going to be this tension.
Yeah.
So who then makes those judgment calls? Because as you said, it's hard for a poor doctor sitting at a patient's bedside to be the one making the call. So at what level of decision making does this need to be set out? And have you got advice to governments just how to navigate this space?
Well, it's very, very tough. I mean, so for example, I did say that contribution is perhaps not the key point. But of course, in reply to that, what about health workers? They're going to be making contribution. So even if they have less chance, or maybe if they're going to go back and save more people, that's what we should do. And there is an argument which I hate, but I think we have to face up to it, which is to say, well, the poorer the country, perhaps more these issues about contribution matter. So in a wealthy country, you're not relying on anyone particularly. We have the luxury to treat everyone on the basis of themselves rather than their contribution. But in a developing country, maybe there are some people who make a special contribution and could be given priority, awful though that sounds. There needs to be obviously high-level guidance, but it needs to be simple enough to use at the bedside. So we'll be cutting corners, there'll be some pragmatics, but we don't want a doctor to have to sit next to a patient and say, I have made the decision not to put you on a ventilator. We need the doctor to say, look, we've shortage of ventilators, we've got national guidance, I followed the national guidance, I can't do it. I'm on your side if I possibly could appeal. If I could get the rules changed, I would. I'm with you all the way. But these are the rules and I'm afraid you don't fit. But I think it's also very important that we think, well, that doesn't mean you're written off now. That if you don't get access to the scarce resources, there's still a moral duty to treat people with the utmost care and dignity, the best form of palliative care, best form of pain relief, rather than thinking, okay, they're not going to recover, let's put all our resources elsewhere. So we have those dilemmas as well.
Gosh, it's such a fraught sort of set of moral dilemmas that this is raising. I'm quite intrigued by this question of the distinction between more industrialized and developing countries and countries where resources are particularly scarce. And I guess the question it raises in my head is whether we've got a moral duty, those of us in industrialized countries and the policymakers and governments, to then support developing countries so they don't have to face such an acute dilemma. And what is sort of the moral and ethical perspective on that?
Well, so I think in terms of improving healthcare systems or giving access to ventilators, it's not difficult for the world to act and to, you can build a hospital in a few days, we've found, at least the right type of hospital. So those things can be done. I think the more difficult thing is going to be funding lockdown in developing countries. That it's amazing that we've been able to keep people with salaries at home, even without jobs, for many, many millions of workers in the developed world, and they're not starving. How long we can keep that up is another matter, but we can probably keep it up for months if we need to. In developing countries where there isn't the same wealth and social services, social provision, that's going to be very hard, and lockdown won't be effective. And it's not as if the developing world has resources now to be able to feed everyone else, that everything is contracting. So, but you ask what the duty is or what the basis of the duty is. And there are really two different approaches to this. One is a type of humanitarian concern, that we're all human beings. Some of us are fortunate to be wealthy. We should share our wealth with those who are less fortunate. We have a duty, but no one on that view has a right to our help. It's a type of goodness of our heart argument. We should do these things. Alternatively, there's a rights-based argument. It says, well, everyone has a right to live, everyone has a right to health, and it so happens that the wealthy countries are hoarding their resources. They have no right to hold on to those resources in the face of a global crisis. And so they have a duty to contribute to others. And morally, that feels quite strong to me. That feels a strong argument, particularly when the wealth of so many developed countries is ultimately built on exploitation that has put other countries back. So there are many arguments to say that there are moral duties. They've never turned into legal duties. There's never been a framework that says that the wealthy countries must legally share their wealth or face some type of sanction if they don't. So all the argument is a moral duty. And we have tended not to step outside a humanitarian framework. And this is interesting, problematic, because in the humanitarian concern, the wealthy are in control. It's our money, we can do what we like with it. In a rights framework, the poor have more, not necessarily control, but much more say, and if there's a court, power. So humanitarianism, although it in many ways is wonderful, it's very conservative. It doesn't do anything to change the existing power structures. It doesn't do anything to stop the same thing happening again.
And I guess at the moment, it's trying to appeal to people to then support others in other countries when we're facing shortages and dilemmas and we need more funding sort of at home. Is also, this is the communication of this as well, from either a humanitarian or a rights-based perspective. Yeah. Joe, thank you. You've really outlined some of the moral dilemmas there. And I'd just like to ask you, as a moral philosopher, how can moral philosophy really help us through this? What are the ways that moral philosophers can weigh up these kind of dilemmas? So just please talk us through, as a moral philosopher yourself.
So what everyone wants from a moral philosopher is a sort of set of guidelines.
Yes,
and if you follow my rules, I guarantee you will be a good person. Okay. Unfortunately, we don't really have that. But what we've got are maybe 2,000 years of reflection on moral problems and thinking way through. And there are a number of traditions of thinking in moral philosophy, and they're often put forward as rivals. So you have to be a utilitarian or a Kantian or an Aristotelian. But I prefer a much more eclectic approach where you think about what each of these traditions can teach us. So from a utilitarian tradition, the idea is we try to maximize good consequences and minimize bad consequences. And this is the government's first instinct. What types of policies are going to bring about the fewest deaths and the least economic damage? So that's a purely consequentialist frame. What can we do that will have the best consequences? And obviously that is going to dominate thinking. You can't get away from it. In a pandemic, you need to understand the consequences of all your actions. But from a Kantian perspective, you'd be thinking about, well, what are ways of respecting people, even in a pandemic? So don't lie. Treat people as grown-ups. Respect them. Don't exploit anyone. Don't neglect them. Think about health workers, transport workers, the people who are very, very vulnerable. Delivery drivers, who's taking care of those? So even if it means ultimately more people may die, there are going to be some people that should have priority in resource allocation and in protection. So the Kantian view, don't exploit, don't treat people as a means, I think is very important here. But also something that's coming through quite strongly, I think, although not in this language, are Aristotelian considerations about character. So how are our governors, how are our presidents, how are our prime ministers behaving? Are they showing courage? Are they showing decisiveness? Are they showing concern? Are they showing respect? What do we learn about the moral characters of our leaders from this crisis? Then finally, I'd say that there's much more recent work on the ethics of gender and the ethics of race that sensitize us to the way power works and how discrimination, indirect discrimination works. So the gender perspective is very interesting, that all the statistics we've had shows that men are dying more than women. Does this mean the pandemic is not a problem from the gender point of view? Well, probably it doesn't mean that at all, because a lot of women are bearing the brunt, extra childcare, homework. Women are in caring professions where they're doing a lot of the work and are subject to risk. Women are often in short-term and temporary part-time employment. They're going to be the people who lose their jobs. So there's a very interesting gender perspective we need to think about. But even more, in the US and the UK, we're seeing racial disparity in who's being affected. And that I think, was it the first 10 doctors in the UK who died were all immigrants or from overseas, from developing countries. And so we've got this not completely understood disparity in who's dying. And so what the perspectives of gender and race show us is that a policy that looks universal can have very different effects for different groups. And so we need to take those differential effects into account if we're going to be fair and treat everyone as equals.
Yeah, brilliant. Thank you very much. You really carefully outlined there the sort of value add of moral philosophy, which I'm pretty persuaded by after all that conversation. So just sort of then drawing back to policymakers on the front line, governments around the world who are having to develop COVID-19 response strategies, think through the lockdown, the ethical dilemmas. What are the practical advices and lessons that come out of this and that you'd give policymakers weighing up all of these ethical dilemmas?
Yeah, well, it's very difficult for me to say very much, but I think we are still at a very early stage of the pandemic. With luck, we're also at the very late stage of it. Perhaps it will disappear. Perhaps we've done enough. Perhaps we'll get a vaccine. But there's a possibility that if this was a horse race, we now know who the leaders are at the first fence, but that doesn't tell you who's going to win. So we know some countries have come out with enormous credit. So New Zealand and Greece are countries I would, for example, point out. Israel has done very well in terms of minimizing the number of deaths. A number of countries in Eastern Europe have done incredibly well. So all of these are leading now. But we don't know what happens when international travel starts again, if it ever does. So if you've protected your population from the virus, how are you going to keep them protected next time round? So actually, we don't know which policies are best. When the historians are writing about it, they will tell us that one or two leaders had the wisdom and foresight to do something, but everyone's making it up as they go along. And so it's too early to tell who has the best policies in terms of minimizing death. But it's not too early to tell which leaders have shown great leadership and great character in leadership. So some have been brave, as I've said, some have been very perceptive, some have listened to everyone, but others have been dogmatic, they've been deceptive, they've lied. There are claims that some leaders have been somewhat corrupt in terms of trying to favor their friends or even their own businesses. Some have been opportunistic, some have been authoritarian. And it's not too early to tell what character people are showing. And so I think at this stage, of course, we need to think in terms of the long-term consequences. But politicians are going to be judged just as much on how they acted and what character they showed as their results. And I would encourage them to think more along those lines.
Great. Thank you very much, Joe. It's been such a pleasure having a conversation with you around these issues, and we hope we'll be back for more conversations in the future on this. Thank you so much.
Okay. Absolutely my pleasure. Thanks so much, Emily.